I'm Michelle Kittleson, heart failure transplant cardiologist at Cedars-Sinai in Los Angeles, California. I'm here with Dr. Rakesh Gopinathannair. Dr. Gopinathannair is Director of Cardiac Electrophysiology Laboratories at the Kansas City Heart Rhythm Institute. He authored the recent AHA scientific statement on managing atrial fibrillation in patients with heart failure and reduced ejection fraction. Now, into where all the excitement is, which is catheter ablation. Why is every electrophysiologist I know so excited about these trials?
So in the past, I would say 5 or 6 years, at least there have been 5 different randomized studies looking at this population of HFrEF and AF. So I'll discuss briefly 2 major studies. One is the CASTLE, as you said, 360 some patients with ejection fraction less than 35%. They all had a device that allowed continuous monitoring of atrial fibrillation. They were randomized to catheter ablation versus medical therapy. 70% of the patients were persistent atrial fibrillation, and about 70% of the patient population randomized to the medical therapy got rate control, but the 30% got antiarrhythmic therapy. Overall, 60 months of follow-up, catheter ablation substantially improved ejection fraction, reduced heart failure hospitalization, and also reduced mortality. In the rate control arm, the medical therapy arm, there was no increase in ejection fraction compared to almost 8 to 9% increase in ejection fraction in the other arm. The other study was called the ATAC trial that looked at patients with the same kind of profile. So they showed that reduction in AF recurrence was substantially better with the catheter ablation compared to antiarrhythmic therapy, and also showed a mortality benefit with catheter ablation as well. So there are 2 things that I think are important. One is that antiarrhythmics, potentially the adverse effects of antiarrhythmics may offset any benefits from maintenance of sinus rhythm, number one. I'm not saying that antiarrhythmics won't. They're inferior to ablation, but at the same time, they could cause more issues. Number 2, it was clearly shown that the lesser the AF burden, the better the outcomes. One should not be under any illusion that we are curing AFib by catheter. But the idea here is that you don't need to be in sinus rhythm 100% of the time. So I think the burden reduction with a better ablation strategy, along with avoiding potential adverse events of antiarrhythmics, could be the combination. I mean, there is a caveat here too. Not every heart failure patients are not similar. If you look at studies, catheter ablation compared to medical therapy or antiarrhythmic therapy with cardioversion has been shown to have less AF recurrence, and that along with avoiding antiarrhythmics perhaps translated into better outcomes.